So welcome everyone to the first webinar of the Gender and Digital Health webinar series organized by the United Nations University, the International Institute for Global Health, by the University of Cape Town and BBC Media Action. Get started. So this monthly webinar focuses on the gender dimensions of digital technologies for health. And these webinars will happen at the last Thursday of each month at 9 p.m. to 10:30 p.m. Kuala Lumpur time. And please, the next slide, Vidya. You only need to register once to be invited to all sessions, and all the materials that we will present and the recording of this webinar will be shared with all the attendees. My name is Claudia Lopes. I'm a research fellow at the United Nations University, the International Institute of Global Health in Kuala Lumpur, Malaysia. I'm a social psychologist and methodologist working on gender equality, big data for policy, and digital health, and I will moderate the webinar today. Next slide. So we would like to know a bit more about yourselves. So we have a small poll. So if you please select your answers about what is your gender and what is your expertise area. Okay, so the large majority is female and working on gender and digital health, and also some of you in digital gender, but the majority working on health systems. So yeah, this is the right webinar for you. Please, the next slide. Okay, so the session today is going to be divided into 3 parts. So after the introductions, we will have 4 presenters, and they will present their research in about 40 minutes. And then we will have a discussant that will have some remarks, some summary of the presentations and some questions to the panelists. And then we will open a Q&A for 30 minutes. So please, if you haven't done so, introduce yourselves in the chat, and you can also share comments there. So our first speaker today is going to talk about the gender gap in phone ownership, the magnitude and drivers. So Diwakar Mohan is a clinician and public health scientist based at the Johns Hopkins School of Public Health. And please, Diwakar, over to you.
Thank you, Claudia. It's a pleasure to be here. Next slide. Yeah. I'd like to begin by defining this concept of the digital gender gap. This is the gap that exists when women in the reproductive age group, usually defined as about 15 to 49 years, do not have the same access to digital services at the same levels as men or other members in their household. Mobile phones, which are the most basic of digital services and form the backbone of many of these direct-to-consumer programs, The implication of this gap is that the target population for many such programs using mobile health solutions, especially if they're targeting reproductive health age group women and focus on reproductive health issues, needs to be calibrated down from estimates purely based on household ownership of mobile phones. I want to use this opportunity to drive home 3 very important messages. The first is that the magnitude of the gender gap in mobile phone ownership can be quite substantial and vary across settings. The second is that this gap is influenced by social determinants and is greater among the most marginalized. The last key message is that the phone access is associated with significantly greater adoption of some health behaviors, but not all. Next. For the purposes of my presentation, I'm going to draw upon 3 data sources. The demographic health surveys from across 15 countries in sub-Saharan Africa and Asia, the most recent family health survey from India. When I say that, the most recent one with data that is available, which is from 2015, and the mobile gender gap report from GSMA for 2020. These findings have been published elsewhere and the references are provided on the slide. Next. The key message that I want to highlight first is that the digital gender gap can be substantial and variable. Next. We have a couple of questions to get us going. I'll be providing you answers down the line to see if your estimates were spot on. You will need to scroll down all the way to see all the choices available to you. What is the average magnitude of the gap between men and women's phone ownership globally? What region has the biggest gap between men and women's phone ownership? Thank you to all of those who responded to the poll. The average magnitude of the gap ranges from 5 to 15%, depending upon what sources you rely on. DHS coverage data based on access shows 13% across 15 different countries, and the GSMA data based on ownership shows an average of 8% across 10 countries. I asked which region had the highest gap, and many of you had responded with South Asia, and it's about 23% out there. Next. This graphic from the GSMA highlights the wide variation in this gap across the world. The figures in gray indicate the prevalence of mobile phone ownership for women, while the purple highlights the gender gap. The figure in blue shows the number of women who are still unconnected. Can you click? Almost 400 million women are reported not to own a mobile phone, with almost half of them from the South Asian region. What is not evident from this graphic is that there is a lot of variation across countries within the same region, as well as between cities and rural areas. Next. The digital gender gap that we quantified previously, it's also affected by many social determinants, including wealth, education, social groupings, urban and rural residents, etc. The net result is that this gap is greater among the most marginalized. I'd like to illustrate this point using data from the Indian survey. Here, you see the rates of mobile phone ownership by households and the women's reported access. The pink dots are the household ownership, and the blue dots represent the women's access to phones. As you can see, there is wide subnational variation among the different states. The gap, represented by the length of the line segment, is on average smaller among the urban population of the states compared to the rural populations. The rural gap is as large as 60% in some states and 40% in urban areas. Can you click? Madhya Pradesh, which we will highlight in the rest of the presentation, has high rural and urban disparities. Next. Carrying along the same lines, the figures showed disparity among the different levels of education and wealth across India. The richest and the most educated have the smallest gaps in mobile phone access. A point to note is that there is still a 20 to 25% gap among the highest strata of society. This matters because digital health programs have the potential to introduce inequities and exacerbate existing ones due to the selection bias created by who has access to a phone. Next. Phone access is associated with higher rates of adoption of some key health behaviors, but not others. Next. This figure graphically illustrates the odds ratio or the likelihood of the outcome of selected health indicators in the maternal child health continuum. The broken vertical line in the middle is a null point, or 1. To the right of it are those with a higher likelihood among those with phone access, while those to the left are less likely to be seen among those with phone access. Can you click? As you can see, key indicators of contact coverage like postnatal care, antenatal care, and skilled birth attendance are higher among those with phone access along with key immunization indicators necessary for child survival. Can you click on it, please, Vidya? Only the breastfeeding indicators, which are known to be higher among the poor, do not appear to be influenced by phone access. So this poses a question. Does phone access by itself influence these indicators? Or is this merely a result of who can afford a phone? Evidence from decomposition analysis that's not shown here suggests while certain indicators like stillbirth attendance are more about who can afford a phone, other indicators like immunization appear to be influenced by the availability of access to a phone. Next. To conclude, it is important to understand the implications of this digital gender gap. The gap is worsened by social determinants, which can also influence health. The access to phones is more likely to impact interventions delivered by community-based health workers, including immunization and care for pregnant and postpartum women. Unless we take into account this gap while planning, digital health programs have the potential to exacerbate inequities. Thank you. Back to you, Claudia.
Thank you very much, Diwakar, for these fascinating findings. Our next panelist is Amnesty LeFevre and Kerry Scott. So Amnesty is Associate Professor at University of Cape Town, who specializes in the evaluation of digital health solutions in low middle income countries. And Kerry Scott is a social scientist and associate faculty member at Johns Hopkins School of Public Health. Over to you.
Thank you so much, Claudia. Apologies, I didn't realize I was on mute there. And thank you to everybody that's attending, and we're grateful for the opportunity to be here and present today. Kerry and I wanted to start our presentation with a broader thanks to the Gates Foundation for supporting the work we're going to present today, to our collaborators at BBC Media Action and Oxford Policy Management in India, and as well to the women and their families in Madhya Pradesh who generously gave of their time and perspectives to inform the survey data we're going to be referencing today. We'll start our presentation by presenting a conceptual framework which aims to outline key determinants of phone access and use. We've sought to apply this framework to a case study in rural India in the state of Madhya Pradesh, which is home to roughly 20% of India's population. As part of efforts to apply this framework, we'll draw from quantitative and qualitative research results to make 4 points. Sorry, Vidya, if you could just go to the next slide. Thank you. The first point is that men have access to higher quality phones with more features than women. Second, women are able to perform far fewer tasks on the phone than men. Third, ingrained social norms limit women's actual and desired use of phones. And lastly, women's types of phones are more limited than men's. In reflecting on these points, we hope to catalyze discourse on the importance of understanding determinants of women's access to and use of phones and the implications for health systems and future digital health programs. So in this next slide, and if you could just advance the slide one more, Vidya, thank you. In this next slide, we first wanted to take a step back and outline the sources of data for which you'll see in the slides to come. As part of a 3-year evaluation of Kilkari, which is the world's largest maternal messaging program of its kind, and one of the Indian Ministry of Health and Family Welfare's flagship health programs, we conducted a household listing across 4 districts in Madhya Pradesh. This led to the identification of just over 20,000 pregnant women, roughly half of whom did not have access to a mobile phone. If you could just advance the slide one more. Amongst the 50% of women that did have access to a phone, we administered a quantitative survey, and amongst a further subsample, conducted qualitative interviews. We've sought to depict the case study sample in the pyramid visible on your screen to underscore the likely differentials in sociodemographic characteristics between those at the base of the pyramid unable to access a phone and those at the top with access. Let's now shift over to Kerry, who's going to help us understand the determinants of phone access and use. Kerry?
Thanks, Amnesty. Vidya, we can go to the next slide. Thank you. We developed a framework to better understand the multifaceted aspects of the gender gap in phone access and use. This framework identifies 5 immediate or proximate determinants of women's phone use: access to the handset, the phone's characteristics and functionality, the woman's digital skill, permitted and desired use, and time allocation. These determinants are embedded in a set of secondary or distal determinants at the level of the woman, the household, and the broader context. Next. Key determinants of phone use within the woman are sociodemographic characteristics, such as her age and her level of education. She will also have her own unique set of individual attributes that can affect her engagement with the phone, such as her empowerment and her personal self-efficacy. These attributes exist within the household context. The family's wealth, for instance, will influence the number and types of phones that they can afford and the financial recharges that they put on the phone plans. Phone needs and allocation will also be influenced by which family members work outside the home and need a phone to coordinate work, or if household members migrate for work. Whether the woman lives in a nuclear family or a joint or extended family arrangement, and the relational dynamics at her parents' home and her marital home will influence her phone use. The broader context of cellular networks, electricity, and market considerations, such as phone plans, add a further layer of secondary determinants of phone use. And of course, undercutting all levels of the framework are the gender norms and attitudes towards women's phone use. We'll now briefly describe the 5 immediate determinants and explain how they were manifested in our rural Indian case study to drive the wide mobile gender gap there. Next slide, please. Access to the handset relates to whether the woman has a phone and whether she owns a phone or uses someone else's phone, and finally, how often that phone is close to her throughout the day. In India, among women who said they had access to a phone in our case study areas, far fewer of them owned phones compared to their husbands, a gap of 19%. And even among those who owned phones, the women depended on their husband or sometimes their brother to buy them the phone as a gift. So here an interviewer asked who bought this phone, and the woman said, "My husband, who else will buy the phone?" Also, even when women owned phones, if their husband's phone broke, he would often take her phone until he got a new one or got his phone fixed. This was sometimes explained because he needed the phone for work, whereas only a quarter of our women worked. Women also discussed that their phone was commonly kept in a central space in the home while they moved around the compound doing chores. This made it easy to miss incoming calls. Among women who shared phones, it turned out they really were just borrowing their husband's phone, which meant they only had access in the mornings and evenings when he was home. All of these gender differentials in access to the handset were grounded in norms of low financial autonomy, subservience, and domesticity, particularly around far fewer women working for pay outside the home. And next slide, over to Amnesty.
Thanks, Kerry. In this slide, we've moved along the framework to explore the second proximal determinant of phone characteristics and functionality. Phone characteristics might include the type of and features available on a phone, as well as available credit. For functionality, while there are a range of ways we could possibly assess this, in India, we've sought to look at this by 3 conditions. The first, whether a phone can hold a charge. The second, whether the touchscreen or keypads work as intended. And the last is whether the screen is cracked so severely as to impede visibility. From our case study findings, we found that husbands had higher quality phones. This included not only a greater proportion of smartphone ownership among men as compared to women, but as well men having more features on their phones. A further critical factor to enabling phone use is whether or not there's available credit on the phone. This is particularly relevant in contexts like India, where most of the population relies on what are called prepaid packs versus postpaid plans, which allow you to pay the bill at the end of the month. Nearly 90% of the women in our sample reported relying on men to top up or recharge their phones and thus add credit to enable use. This finding was additionally echoed in our qualitative results, which suggest that husbands reported that as the primary earners, they would assume the role of adding that credit. In India and in many low resource settings, increasingly phones without available credit or zero balance periods, as we've noted in the slide, are unable to even receive incoming calls, essentially rendering them useless. Perhaps not surprisingly, this becomes yet one more way in which men become gatekeepers to women's use of mobile phones. Overall, the observed and reported gender gaps in phone characteristics and functionality were underpinned by social norms around women's low financial and physical autonomy and subservience to men. Let's now shift to our next determinant of digital skills. Next slide, please. Before we jump into this, we wanted to add another quiz question here. And so on the slide, and you'll see hopefully video will make the quiz available to you. We've sought to ask you a quiz on what proportion of women and what proportion of men do you think in India can open an SMS? So please just take a second to fill that out if you can, and then we'll just wait to quickly to just get those results, and make sure on the second question you scroll all the way down to see that. Okay, thanks to those of you who answered that. Great. And could you just do me a favor and advance the slide too? Great. So we can see that most of you were pretty consistent. Actually, you thought in rural India, fewer women than our results suggested actually could open an SMS, but more or less we were, you were pretty close to what our findings were. So we didn't even need to show you the results. You would have guessed it. Great. So next slide. Great, thanks. So in addition to whether men and women could open an SMS, we also sought to whether they could assess 4 additional tasks. First, could they navigate IVR or interactive voice response prompts? So that's, for example, if you get a call and it says press 1 to speak to a doctor, press 2 to speak to a midwife or nurse. Next, we thought to see whether they could save contacts on the phone or whether they wrote them separately on a piece of paper.
Advance one. Yeah.
Oh, perfect. Thanks, Kerry. Whether they could give a missed call, and then finally, not only whether they could open the SMS, but whether they could open and read it. So from these 5 basic tasks, we've additionally sought to generate an overall composite score, which essentially averages all of those into one to denote the average ability to perform all 5 skills. So from our Q&A, during our Q&A, it might be worth revisiting why we've selected these basic skills, but I would simply note here that men and women were asked to perform them in front of our enumerators on their own mobile device, and as such, these tasks needed to be device agnostic. So what we can see from the horizontal blue bars is that overall, women were able to perform far fewer tasks on a phone than their husbands. If we look at the overall score, we see a gender gap of nearly 30%, which is consistent with what many of you guessed earlier. And this was largely driven by differentials in their ability to open and read text messages. So Kerry, over to you. Can you tell us a little more about qualitative findings on skill differentials between men and women?
Thanks, Amnesty. You can go to the next slide. So digital skills were hindered by higher rates of illiteracy among women. The inability to read and write and low numeracy closed off many functions on the phone. And here the interviewer says, okay, what all do you know on the phone? Can you use it? And the woman says, I haven't studied, sister, so how can I? Also, we found that in some families, the husband discouraged the wife from learning how to use the phone, instead dialing for her and handing the phone over, or asking her not to touch the new phone and instead use her older phone with fewer features. So here a woman explains, my husband does not give it to me, and I do not even feel like learning to use it. If I do, I will get interested in it. It's quite telling. Next slide, please. Looking at permitted and desired use. This is about what the family and society think is appropriate and suitable use, and what the woman herself wants to do. We found very narrow permitted use. Women were to use the phone to speak to their natal families back home and to keep in touch with their husbands when the husband was out of the house. Most said they had no friends or had lost touch with friends, and very few were using the phone for employment. And this quote kind of sums it up. A woman simply says, who else would I talk to? Just mom and papa. Now, interestingly, women themselves expressed similarly limited desire. These were grounded in norms of domesticity, relationship maintenance, and purity, wherein women were safe from accusations of improper behavior if they stayed within this narrow set of phone uses. Back to you, Amnesty.
Thanks, Kerry. Slide, great. So in this next slide, we reflect on the importance of time availability and allocation for enabling mobile phone access and use. Specifically, this determinant considers questions such as whether women have time to spend on the phone, and perhaps most importantly, whether they can be seen to be using the phone within their family, household, and community contexts. Our case study findings suggest that overall women spend less time on the phone, You'll see from the horizontal bars depicted at the top of the figure that the proportion of women using the phone on a daily basis was nearly 20% less than that of their husbands. Beyond the time spent on the phone, we asked both men and women about types of use. Overall, the types of use were much more limited for women. As depicted in the figure, while over half of men in the study sample reported using the mobile internet, almost none of women did. Similar gaps were observed for camera use, listening to the radio or pre-recorded messages, or using text messages to communicate with health workers. Let's turn back to Kerry to hear more about findings from the qualitative research. Kerry?
Thanks. You can go to the next slide. Respondents spoke about how women were busy, so they couldn't spend a lot of time on the phone. However, when we dug in more, it appeared to be that spending less time on the phone was strongly linked to social norms that made women vulnerable to negative judgment if they were seen to be spending a lot of time looking at or speaking on the phone. These were norms around domesticity and subservience, where she should be seen to be working in the home and does not want to be accused of shirking her domestic responsibility, but also around norms of purity, which made women careful to not be seen to do anything that raises questions of infidelity. And here a husband explains that if a woman is seen on the phone for a long period of time, they might think she uses it for spurious purposes, that she engages with bad persons, that she indulges in obscene talks. Back to you, Amnesty.
Thanks, Kerry. Video slide for me, please. Thank you. Great. In our closing slide, we wanted to reflect on the implications of our discussion today. Overall, we sought to present a framework which captures the relationship between a range of proximal determinants. As we've seen, the factors underpinning access and use are complex, multifaceted, and likely to vary by context. However, access and use constraints have implications for who programs are reaching and who they're missing. This underscores the need to develop concurrent strategies to reach those without access to mobile phones, who are likely to be the most marginalized and disadvantaged. Unfortunately, because of how we've chosen to focus on the sample of respondents with access to phones, theirs is a voice that we're missing. Amongst those with access to a phone, we need to understand access and use profiles and the associated implications for designing appropriate initiatives likely to optimize technology use for health. From Dr. Mohan's talk, we saw global and India-specific trends in women's access to phones as compared to men's. Much of women's access is shared, and as such, we need to understand what the implications of this are on program design, and in particular for data privacy. Lastly, we've only superficially touched on this today, but you'll have seen in our presentations mention of different metrics used to measure a range of outcomes. Overall, there's a need to attain consensus on metrics and approaches for assessing access and use. And I'll note that we hope to have some workshops as part of this larger seminar series that take us in that direction. I'll close for now, but we look forward to continued discussions, and thank you for your time. Over to you, Claudia.
Thank you very much, Amnesty and Kerry, for all your reflections and for also bringing voices from the field. I just want to tell the participants that you're free to tweet and you can quote our presenters, but please use the hashtag GHH Talks, that is Gender and Health Hub Talks, and Gender and Digital Health. So our next panelist is Sara Chamberlain. She's the digital director of BBC Media Action in India, and she's going to discuss the gender dynamics in social media. Over to you, Sara.
Thanks, Claudia, so much, and hello, everyone. So BBC Media Action is the international development NGO of the BBC. So we believe in media and communication for good. Our projects and programs save lives, protect livelihoods, counter misinformation, challenge prejudice, and build democracy. In addition to partnering with Amnesty, Kerry, and Diwakar to design research to understand low-literate, low-income women's access to and use of mobile phones, BBC Media Action is also exploring women's engagement with social media in India and the implications for social and behavior change communication, including on health. Today, I'm going to share some of the emerging results of a landscaping study that we're conducting to support the Bill and Melinda Gates Foundation in designing its digital strategy for women's empowerment in India. I'd like to thank Ambika Tandon, Ayush Rati, and Arjun Khanna for all their hard work on this study. Next slide, please. The landscaping study aims to understand women's access to and use of social media platforms and chat applications in India, including online gender norms. It consists of a literature review and key informant interviews. It's important to note that there's very little disaggregated data on this topic in India, particularly published in peer-reviewed journals, and we've had to primarily rely on gray materials, including from the private sector. More primary research is urgently required to fill these gaps. Today, we will discuss the following questions, starting with the biggie: is the digital revolution in India male? And subsidiary questions: does women's engagement with social media platforms differ from men's? What role do online gender norms play in shaping women's engagement with social media? What are the characteristics of female social media influencers? And what are the implications for digital interventions to improve health outcomes? Next slide, please. So let's go now to a quiz. If you could release the quiz, Vidya. The first question is, prior to COVID-19, which social media platform had the least number of women users in India? Your options are Facebook, Instagram, Snapchat, TikTok, and Twitter. Okay, I'll give people a minute to vote. Okay, you all guessed correctly. It is indeed TikTok. So according to We Are Social and Hootsuite, in January 2020, the social media platform with the lowest percentage of women users in India was TikTok. It had more than 112 million active users, but only 9.5% were women. The Indian government actually banned TikTok in June 2020 due to national security concerns. Next slide, please. So according to the GSMA, before COVID-19, India was set to become a smartphone superpower, second only to China, with 1.1 billion smartphone connections by 2025. But according to a 2019 study by Learn Asia, only an estimated 9% of all women in the country use social media. This makes sense in a context where, according to the GSMA, only 14% of adult women in India own smartphones, and only 21% had ever used the mobile internet in Q1 of 2020, which begs the question, is the digital revolution in India male? According to a report published by We Are Social and Hootsuite in January 2020, men dominate social media platforms in the country. As you can see from this slide, only 14% of Twitter's users and only 23% of Facebook users were women in January 2020. It's worth noting that according to sources at Facebook, this percentage of women using the platform has increased to 26%, but this data is not publicly available. In addition to this significant gender gap, literature also indicates that, as with the data that Diwakar presented, social media use increases with education and wealth, and urban and younger internet users are more likely to use social media. Next slide, please. As you can see from this slide, women's use of social media platforms and chat apps also differs radically from men's. Unlike men, many women prefer to use social media platforms to maintain existing networks and communities behind digitally closed doors, rather than venturing into public spaces to build new ones. This has implications for interventions seeking to leverage social media to support women in expanding their networks, to build bridging social capital, i.e. to access new ideas, new opportunities, and new ways of doing things. There are lots of sources for this information that you can see on the slide. So why do you think women in India are keeping their heads down on social media? Our next quiz will provide some clues. So my question is, what percentage of women internet users in India have experienced online aggression, trolling, bullying, abuse, or harassment? I'll let you all vote on that. So the majority of you said 80 to 90%. Fortunately, it's not quite that negative, but it's still pretty bad. So research published by Feminism in India in 2016 indicated that an estimated 58% of women internet users in the country had experienced online aggression, so trolling, bullying, abuse, or harassment. Next slide, please. So unfortunately, offline gender norms are often perpetuated and even amplified online. According to a 2019 study by IT for Change, 54% of women who faced gender-based violence online did not seek help from parents or relatives. And 27% of these women said this was because of concerns that their devices might be confiscated. So they're not only being bullied, but they're not asking for help because despite the bullying, they don't want to be cut off, right? They still want the internet. So furthermore, women from marginalized communities face higher levels of violence on social media than, for example, high caste Hindu women. The environment is unfortunate. This environment, unfortunately, is deterring women from actively participating in social media in India. According to a 2019 study by Learn Asia, 57% of women social media users in India are cautious about posting content online. Next slide, please. Despite the digital gender gap, many of the top influencers on Instagram and prior to its ban on TikTok in India were women with tens of millions of followers. Most are mainstream celebrities who use social media to build their largely male fan bases and to endorse products. There are some notable exceptions. Sangeet Jain, pictured on the left in a green jacket, is a social worker in Delhi who talks about mental health issues and domestic abuse with her 2 million plus followers. Feminist influencers in India, such as She the People TV on Instagram, have much smaller numbers of followers. She the People TV has approximately 400,000, but these numbers are growing. Others, like Janat Zubair, with 21.3 million followers on Instagram, may reinforce some gender stereotypes of femininity, but as an independent, self-confident Muslim woman who is promoting hand washing and mask wearing during COVID-19, Zubair often embodies an alternative gender identity. Next slide, please. In the rush to digitize during the COVID-19 pandemic, many development sector actors are using social media to distribute critical health information to citizens. This approach risks leaving many women behind. There needs to be a concerted effort to address the digital gender gap and online gender norms in India. One possible strategy could be to focus on women's empowerment collectives. In India, 47 million member households have been mobilized into 4 million self-help groups since 2011. These collectives might provide safe spaces and social support for peer-to-peer learning. Digital champions within these groups could potentially help women learn how to protect themselves online and use social media as a tool for empowerment. I'm going to leave you with this story. Next slide, please. Although their members only have limited access to basic phones, these grassroots leaders of a rights-based collective of 2,000 Dalit women in Tamil Nadu, supported by an organization called READ, all own smartphones. They're using these phones to photograph and video shortcomings in public service delivery in hospitals, schools, and in the community. They are then sharing these photographs and videos with local government officials as evidence alongside printed petitions with thousands of signatures or even thumbprints from their members in the community. They also share these photos and videos on social media to put pressure on local government to redress the situation. These efforts have been effective in bringing about visible positive change and have created a productive relationship of respect between these women leaders and their elected officials. Thank you very much for listening, and back to you, Claudia.
Thank you very much, Sara, for sharing your extensive knowledge on the gender norms in social media. Next, I would like to introduce our discussant, Alex Tyers, and our series coordinator, Callum Anford, who is going to manage the Q&A. So Alex is a gender and inclusion specialist who enjoys both researching the gender digital divide and creating digital products and services for women and girls. She's now currently the product manager of Oki, which is a UNICEF period tracker app designed for and with girls in Mongolia and Indonesia. So Alex, the floor is yours.
Thank you so much, Claudia. And thank you so much to our presenters. Really interesting stuff and really great presentations. So what we heard tonight from the presentations and our panelists is that the gender digital divide is stark and it has huge implications for healthcare. So we saw from Dr. Mohan's session that globally, women are much less likely to own and use a mobile phone than men. I think one of the figures he quoted was the GSMA figure of 8%, but that global figure does mask regional inequalities. So in regions like sub-Saharan Africa or South Asia, this gender gap is actually much bigger. In South Asia, it's 23%. And that global figure also masks socioeconomic disparities. Wealth and education are the biggest determinants of ownership, access, and use, and marginalized women are the ones being left behind. They are the ones who are the least likely to access and use a mobile phone. And this tied in really nicely with Amnesty and Kerry's presentation about the work they did in India with women, particularly around the 5 key determinants of a woman's mobile phone access and use. To summarize those are access to handset, phone functionality, digital skills, permitted and desired use, and time availability and allocation. And these key determinants are so complex and so contextual. And when we're talking about public health interventions for a country like India, and indeed many other countries, the majority of the people that we're trying to support in digital health programmings are women like the women in their study. And so it's really important to understand what digital access and use looks like for them and in all of its complexity. And then finally, we heard from Sara, looking at particularly the gender dynamics of social media use amongst women in India. And as she said, the gender gap in social media use echoes that of mobile access and use. Women in India use social media much less than men. They use it very differently and with much less engagement than men. And one key point that Sara made that I think is really interesting and I'd like to pick up on is the fact that offline gender norms are being replicated and even perpetuated online in the digital space as well. And this is really important because it serves to limit and restrict Indian women and girls' use of social media and the internet and mobile technology. And not just in India, this is happening in many, many contexts. And this matters because if we're talking about digital health and we're talking about using social media and digital technology and the internet to disseminate health information or to run health services, women are being left behind unless we do something about it. And it's also really important to really put a focus on the negative side of social media and the internet and digital technology that is starting to be recognized more in research in the last few years, particularly around digital harms that disproportionately affect women and girls, such as online gender-based violence. And without addressing those and the digital gender gap, this gap or the digital gender gap will only widen. And as Dr. Mohan said, we actually risk worsening health inequalities through our digital health programming rather than closing them unless we address the gender digital divide. To me, the key thing that emerged from people's presentations today is that there's no one size that fits all. It's not just one strategy that will close a gender digital divide. It's clearly so nuanced. And we cannot ignore gender norms. Gender norms are, to me, and to many of the presentations, many of our presenters, the root cause of the gender digital divide. They underpin everything. Other factors such as affordability of devices or cost of mobile data, in a way, they're just outcomes of deep-seated gender and power inequalities. factors like affordability of devices or cost of mobile data, they are the easiest to address in gender digital programming and closing the gender digital divide. An NGO can heavily subsidize the cost of devices for women. They can work with a mobile operator to reduce the costs of data. But many people would argue that as great as these interventions are, they often only act as a band-aid to treat the symptoms of the gender digital divide only, and not the root cause. So with all of this in mind, I'd like to throw a question out to our panelists. What can we do to address the digital gender gap? I'm aware of time, so we only have a short time, so please be brief in your responses. But I'm going to start with Dr. Mohan. As a data scientist, what do you think could be done to help reduce the digital gender gap?
Thanks, Alex. As a data scientist, I'm usually the one who's kind of following the data. Like I'm kind of behind the curve on trying to track who's being missed out, rather than trying to think forward on how can we reach this out to everybody else. But data science does have its uses. Right now, with data science, we know how well to segment the population into those who have certain characteristics that are associated with not having access to a phone. And we could use data as an evidence, as a pointer to target specifically the women or the households where such gaps exist or such characteristics exist. So segmentation and targeting would probably be the two keywords I would use for this. Thank you, Alex.
Thank you so much. Some really interesting points. I'm going to turn over to Amnesty and Kerry. As researchers, what do you think? What's your opinion about what can be done to close the gender gap, or the digital gender gap?
So I know Kerry's going to have the answer, so I'll stop in. I'll jump in with a muddled, somewhat of a response first before she tells us the solution. But I tend to agree with what Diwakar is saying. I mean, but I would just sort of maybe add a little additional sort of color to what he's suggesting. And I think in addition to broadly needing more data, I think we have to promote greater awareness. And I've been happy to see that in a lot of large national scale surveys like the NHFS that Diwakar mentioned, the latest demographic and health surveys more recently have started to add more indicators for measuring different aspects around going just beyond sort of phone ownership, but also measuring sort of other aspects of use. For example, do you use the phone for financial transactions? There's a greater range of questions that we're seeing in a lot of these national surveys, which I think is extremely helpful and a good starting point for creating awareness among the larger community and folks that are designing programs about what the gaps are and where. But I do think these are really scraping the surface. We really need better data. That's the number one thing in my mind. That's a very easy, actionable step, and we can just incorporate these kinds of questions in existing special surveys that are done, whether it's UNICEF's mixed survey or the DHS or others. And as part of that, I think as a community, we have to agree on what the parameters for measuring access and use are. And I think we have to go beyond a simple thing of, do you own a phone? We have to look at when do you have access to the phone during the day? You have to look at the issues on the data on the phone, access to data, who is getting the top ups. There are a range of indicators that I think add more nuance and sort of shed a little bit of light on the magnitude of the gap. And then, as Diwakar is saying, I think if you have better data, you can start down the road of developing digital archetypes and designing solutions that can meet this varied non-homogeneous population. But it still doesn't address that 50% of people at the bottom of the pyramid. So at the end of the day, we have to just be cognizant of whether it's 20%, 50%, or whatever it is, that we're designing solutions that are non-mobile for that population. And Kerry, I don't know if you have, over to you with the actual, better articulated answer.
No, I think I'll just build on that. I mean, one point to highlight is, gender is men as well as women, and we do a better job of accessing men through digital. So I think to not miss opportunities to engage men through phones, because they are an easier group to catch. But, you know, power is never ceded without demand from below. And if we think about patriarchal structures that way, obviously just asking men to be more empowered, empowering partners won't be enough. So I think what you hit on, Alex, is really key, is this multi-pronged approaches. So as our framework highlights, you know, you give a bunch of women phones. That's great, but you haven't addressed the other 4 features of that framework. You do a digital skills training. Great, but you now have not addressed the remaining barriers to phone use and access. So multi-pronged strategies in the sense of multi-pronged digital strategies, but also multi-pronged strategies that are back to our basic understanding of social change. So don't put all our eggs in the digital basket. And I think what Sarah highlighted with collectives and empowerment groups, that digital is one small piece of what they're doing, but they're really about bringing women together, empowering them through literacy campaigns, through accountability and governance campaigns. I think that will see the deeper change that we want.
Thank you so much, Amnesty and Kerry. Some really, really great ideas there. And finally, Sarah, I'm going to throw it over to you. As someone who designs and implements digital interventions, what are your thoughts on what can be done?
Thanks, Alex. And, you know, I'm going to echo some of what has already been said by Diwakar and Amnesty and Kerry. I mean, first of all, as both Diwakar and Amnesty said, it's critical to segment. So to understand who amongst women are using what technologies and what are their characteristics and who is not, has no access to digital. And then it's critical to target using the technology that is appropriate for that segment. So in the context of women's empowerment collectives, so for example, self-help groups, the kind of technology that would be appropriate for to reach or to communicate with a group member could be very, very different to the sort of solution that a leader might be able to use. So as we saw, you know, the leaders of these collectives, a growing percentage of them have smartphones, and most of them are literate and, you know, slightly better educated. So what they can do with technology is very different to what an illiterate woman who has maybe 15 minutes of access a day to her husband's phone. And then I think, as Kerry said, we also have to speak to both women and men, not least because they're the one who's controlling the phone. So if you try and call a woman with outbound calls, as we discovered, probably about 50% of those calls are going to be answered by men. And if you provide a service that women can dial into, it will first be vetted by her husband. But I think it's not just about that male-female dynamic. It's also about household engagement with a mobile phone as a shared device, which is really fascinating, actually. And I think that there must be a way to play to the strengths of that rather than just talking about the weaknesses. So what we've seen, we're doing a pilot right now with self-help groups in Bihar, supported by our partner Pradhan and the State Rural Livelihood Mission, is that women are learning through, we've developed an IVR-based training course. Women are learning with their families. So they're learning with their husbands, they're learning with their sons, they're learning with their daughters, they're learning with their mother-in-laws, they're learning with their father-in-laws, they're learning with their sister-in-laws, and they're all learning together, and they're all learning, you know, in pairs. And I mean, it's incredibly complex and I think really powerful if we start thinking about it's not a one-to-one relationship with the phone. And there's an opportunity to really change norms here. If we think this is a drip coming into a pond, or lots of different people reaching up to access the same thing. And so how do we design for that kind of a dynamic instead of this one-to-one thing that's sort of in our heads? Okay, thanks.
Thanks, Sarah. Really excellent points, lots of food for thought. I'd just like to say thanks again to our presenters for their presentations and for their thoughts on the question I posed. I'm going to hand it back now to Claudia for the Q&A session.
Please, over to you.
Thanks, Claudia. And Alex, thank you for such a great summation of all the presentations as well. So we've got a number of questions coming in on the Q&A. There's a few directed to specific panelists and also a few kind of broader ones as well. So the first one on our side is from a friend at WHO. So this is directed to Amnesty and Kerry in the first instance. I'm going to read it out just for the benefit of people who may be watching this non-live or for future auditors as well. So from your study, we see that SMS health messages may not be reaching women in India as much as men. But when we start looking at women in different economic backgrounds, does this have an impact? For example, will richer women have better access to phones and information than poorer women? And broadly related to that as well, there's mention that MNCH text messages for pregnant women have been successful in India. Are you familiar with that work, and how has that been working? Nice, easy question.
Lots to unpack. I'll take the sort of low-hanging fruit in answering that question, then hand the hard stuff over to Kerry again. So the first is that we've been engaged in a large-scale evaluation supported by colleagues at the Gates Foundation and working with Sarah's team from BBC Media Action and others, evaluating evaluating Kilkari, which is a large maternal messaging program in India. And what's interesting, from the results of that trial, we have looked at differentials in exposure to interactive voice response calls. So because of low literacy rates, and Sarah can say more about this, the messaging program was designed there to have interactive voice response technology versus SMS, which is the technology used for Mom Connect here in South Africa, and similar programs throughout this subcontinent. But in any event, what we've seen is that we've seen improvements in differentials and improvements in health outcomes related to reversible contraceptive use amongst the 3 lowest socioeconomic strata. And that magnitude of improvement happens across everybody, but the magnitude is greater amongst the poorest. So what it suggests to me is that if you are successful in overcoming all of those sort of odds around getting, mobile devices in the hands of the poorest, getting women access to those phones, and then them actually getting the messages, you can have a really important impact on them. And it can have a sort of a pro-poor bias, if you will, in the magnitude of that impact. And we can also talk about exposure to those messages. Yes, by and large, exposure tends to be highest amongst those in the more advantaged demographic profiles, but that's not surprising given who has access to phone, and that those populations would tend to have, own their own phones. But you see a differential impact amongst the poorest if you're successful in getting the content to them, at least in the Indian context that we've assessed. And Kerry, I don't know if you want to say more about that. Diwakar, you're also welcome to jump in there.
I think you covered it, Amnesty. Just that, yeah, SMS was wisely selected as not the right medium. It was pre-recorded audio.
And sometimes I'm always worried about who reads the SMS, right? So
yeah,
with the program, we always know that says, even if we get read receipts and figure out that somebody has opened an SMS, we're not sure who reads the SMS. So we need to be very careful about evaluating and interpreting studies when they claim effectiveness for many of these kind of interventions.
Just to build on that, Diwakar, and to jump ahead to another question, we've got a very interesting and very topical one from coming on the Q&A. With changes in the kind of WhatsApp policy that we've seen around terms and conditions and privacy and so on, have you seen, it may be too early to see, or do you think that there may be some kind of impact in relation to gender in India or more broadly with this kind of change in policy?
I could respond to that. I think it's too early to say. I mean, we don't have research or data to support what I'm about to say, but given that women prefer closed platforms like WhatsApp to communicate with one another, precisely because their content is then private, and we know that they have so many concerns about posting in public spaces where their content is visible because they're afraid of trolling, bullying, harassment, all of gender-based violence. So the change in policy where, there's, even if it's more a perception, a perceived risk, a perceived risk that people are going to be looking at their content and they're going to be able to identify who they are, and that content may be used for commercial purposes and other purposes, I think is going to be yet another deterrent for women to use social media. And chat apps were the one sort of safe place for women. So I think it's a retrograde step, actually. Thanks, Kellen.
Thanks, Sarah. Hugely topical. I wonder if any other panelists would like to jump in on that one. What can we do in the future for other platforms in framing this this need and this kind of reframing to ensure that we're not excluding women?
I do think protecting women's privacy is critical online. I mean, first of all, of course, what we need are safe spaces online. But in the absence of those spaces, ensuring that their groups are private and that their content is protected, and that, you know, it is possible to have a safe digital space on the internet is critical. And, you know, what I would love to see in India, and I know it's been drafted and it's under discussion in the government, is a data protection act, you know, similar to GDPR in the UK. And, you know, I think that that would just be hugely welcome, as it would give a sort of legislative, you know, backbone or support to women's safety online and the protection of their data. Thank you.
Do you think that's realistic though, Sarah? Sorry, I'm just going to jump in and challenge you on that, because I think it's great,
realistic?
but do you think that's, yeah, what you're talking about as a legislation and I mean, what is more immediately realistic? I mean, I'm just thinking like in South Africa, we've been successful in having, you know, basic personal protection of information legislation enacted, and now it's actually enforceable. But India still hasn't been able to move the needle a bit on that. I mean, they have the sort of legislation drafted, but yeah, I just wonder.
Yeah, I mean, I think there's sort of big tensions, because on the one hand, the Telecommunications Regulatory Authority of India has, you know, at least back in, let's see, 2013, really cracked down on violations of, for example, subscribing people to mobile services without their consent. And there was a huge crackdown on that. And so consent is taken really pretty seriously. But as you say, the Data Protection Act hasn't been passed yet, and I think it's been under discussion. I've kind of lost track of time with COVID, but I think for about 2 years now, or at least a year and a half. And I think there is a big tension though here, and this is something that Alex and I have discussed on other panels, between, you know, if you need to deliver life-saving health services and health information to millions of people who we've heard, many of whom can't read, they can't write. It's very, very difficult to reach them. How are you going to take informed consent from those people? Realistically, they've never heard of the internet. They don't know what data is, right? You know, all of these concepts are completely alien. Even if I'm asked to give consent, oh, you know, cookies, yes, 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 tick, 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 oh, privacy policy, tick, tick, tick. Because if you look at those things, they're hundreds of pages long. I mean, it's like reading Lord of the Rings. I mean, how is an illiterate woman, you know, on the Bihar-Jharkhand border going to understand that stuff? So it's not a simple, there's not a simple answer, because if you want to take consent, which I 100% think is the right thing to do, how is it truly informed consent? And, you know, I actually feel that we need the equivalent of sort of ombudsmen or women, you know, people in the community who represent the kind of data privacy rights of citizens. And, you know, ideally from the community, but who are able to read those privacy rules and understand them.
Interesting concept. Amnesty, thanks for jumping in on that one. So just to stay with this topic and broaden it slightly, you also mentioned COVID, which is something that didn't really come up in the presentations we saw today, but obviously in the previous year, we've seen an enormous acceleration in digital transformation around the world, even in some of the kind of hardest to reach groups. I'm just wondering, from all of your experience from the panel here, and please, Alex, jump in as well. What lessons have you taken from COVID and how we deliver services using digital and other technologies to ensure that we don't, I think, entrench or exacerbate any kind of digital divide that we've been talking about across the presentations?
I mean, I think it is impossible to take away the fundamentals of a social safety net and a functioning education system in these areas and not exacerbate inequality. I think we hear these sort of heartwarming stories of children gathering around a smartphone to get online school in rural India, but that's because those are the stories we hear because they're online. I think we are missing millions and millions of children getting offline and millions of women not getting access to the care they need. And I think, you know, digital is never going to be a magic bullet. We need functioning in-person health services, functioning in-person education systems. And I think we just have, I know everyone's trying to make the best of the situation. And of course, pushing content out through phones is kind of all we could do for a while. But I don't think we need to try to put a rosy spin on what COVID has done. So I just, you know, I think that there's a real sadness to all the loss that came of cutting off these in-person services. As much as we love digital, you know, it's a augmentation, it's not a replacement.
Very much agreed.
Yeah, but I think, Colin, just to sort of jump in on what Kerry's saying, you know, I'm always a cynic, unfortunately. So but to play a sort of a glass half full here, I will say that at least the one thing that it has done is showcased a magnifying glass on the inequities that were already present in a large part of the world for some of the most disadvantaged populations. And so, you know, I mean, it's now, I watch the news in the US quite a lot still from South Africa, and you hear sort of clips of the stories every single day about the challenges low-income families in the US are facing, accessing laptops, accessing internet, et cetera, and that's the lived reality of a large part of the world every single day, and in particular, the large part of the world of women and marginalized communities. And so I'm hopeful that if anything comes out of this, it will be a light on the importance of needing to make, you know, these critical technologies more openly available to everyone. Yeah, anyway, that's my 2 cents. Over to Claudia. Maybe Claudia, tell us, what do you think? And from Malaysia, I don't know if you have thoughts on this.
Yeah, I think the digital divide, well, Malaysia is not different from other countries, and particularly from other Asian countries. And we could see that was exacerbation of inequalities related to COVID, and not only the digital, but also all the aspects related with very strict lockdowns that we had here, with the school children not being able to go to school for more than 1 year, let's say, and for migrant families not having their rights fulfilled, and especially in relation to health, in relation to their citizen rights. And so I think the situation is difficult everywhere. And I think the digital is only the tip of the iceberg. So the digital was beneficial for people who had already access to overcome some of the challenges of related with COVID measures, but others who had, you know, let's not think binary, people who have access and people who don't have access, but, you know, people may have access, but then they need to access data. And in relation to that, the government of Malaysia provides free data for people, 1 GB of data, but still people who were not very familiar with certain technologies, I think they are just even more behind than they were before the pandemic.
Thanks, Nadia. Just to jump back to the questions, we've got a little bit of time left. We've got one that's come in from Ranjini, just to stay on this COVID topic for a tiny bit longer. So beyond the kind of unidirectional or one-way flow of information, we particularly need to focus on two-way communication, particularly in local languages in places like India. When we talk about vaccine hesitancy and doubts around vaccination within the population, how do you think we can have that kind of two-way communication with these kind of populations? And I can
have an initial go, and then I'd love to hear what Amnesty and Diwakar and Kerry think. I mean, what we've learned from all of the digital sort of social and behavior change communication work that we've been doing with rural populations, across the North Indian Hindi-speaking states in India over the last decade, is that facilitated communication is absolutely fundamental to reaching the majority of women. Not just the most marginalized women, but the majority of women. And I think the investment in frontline health workers and empowering them and equipping them with effective job aids. And job aids that are easy to use, job aids that are designed with women, for women, and that can support them in this communication and help them have these facilitated conversations with families is fundamental. You just can't take the people out of this. And the other thing I think is really valuable that we've seen from our work is the good old call center. I mean, call centers at scale can actually be incredibly effective. And, I've seen amazing work being done, for example, by the National Health Mission in the state of Orissa. This was several years ago, but they had call center agents, all women, all speaking Oriya, who also had been trained in counseling, and many of them had counseling backgrounds and degrees. And so it was creating employment for young women who were then able to interact with illiterate women and to answer their questions and quick queries and concerns. So despite having sort of been, involved in this digital development for, God, I think it's about 25 years now, I am a very strong advocate of people.
Diwakar, do you want to jump in on that?
I think some of the problems with some of these data is that also that people get snapshots and anecdotal evidence. And as a data scientist, I have very little faith in a sample size of one. So that's one thing that I would be extremely cautious about interpreting such kind of data based on very small sample sizes or selective, homogeneous, and populations that have some special needs as well. So just a word of caution about understanding and extrapolating things from a small sample to all of India as well.
I think a very useful wider lesson for much of our work as well. Thank you. Just two final questions we've got in the Q&A, I think, relating to your presentation. The first are, based on the presentation you gave, are there any kind of indications that your findings are similar to those in other regions? Regions could be, I think, within India and also globally as well. And secondly, but I'd also appreciate the experience in the wider panel here as well, has there been any research on the effectiveness of mobile phone social media messaging around violence prevention in India, or maybe even in other locations as well? So Sarah, do you want to jump in first? And then
yeah, I'll take the second question first. To my knowledge, there's very little robust evidence for the effectiveness of mobile phone, social media messaging around violence prevention, full stop. And I don't think India is any exception. In fact, my understanding is that there are concerns about whether it might exacerbate existing gender conflicts. And I think the reasoning behind that is that say you're trying to target women with those messages and you're trying to communicate with them about support that they might be able to access and places that they could go and safe spaces and resources and things like that, which is an incredibly, worthy, great thing to be doing. But let's go back to the shared dynamics of household phone use. Let's go back to the fact that that phone is in the husband's hand. So the man who's beating her up is the one who you're actually sending the messages to. So we just have to keep coming back to, that's why the research, that Kerry and Amnesty and the team have done around this the dynamics of how these phones are shared and who the gatekeepers are and who's vetting everything and monitoring everything. We really have to keep coming back to that, because otherwise we could actually just make the situation worse.
Really, Amnesty, Kerry, do you want to jump in?
Kerry, I'll let you.
Yeah.
Go ahead.
Yeah, I think absolutely. And there is actually evidence of some interventions being linked to increases in domestic violence in many of the ways that Sarah has traced. But I think an area of hope, to change tack and be a bit more positive, is that, again, with sort of, so social media or direct phone interventions may not be able to target effectively to help women who are in situations of violence, but as a norm adjustment tool, you know, there is evidence, edutainment and social media campaigns encouraging people not to be bystanders, and encouraging alternative ways of conflict resolution that maybe aren't going to target the perpetrator or the victim of the abuse, but are going to try to make it less accepted and less normal, and help those who have observed or who think it's going on be aware of alternative tools to address it. I think that may be a fruitful area. I'll leave it at that.
Alex, is there anything that you'd like to add in addition on that?
I think everything's been said. It's really fascinating. I would just echo what you were saying, Sarah and Kerry, just about there are studies out there on online gender-based violence within the home, and actually a lot of these are because of social media and because of the way the dynamics in the household and the way perhaps the husband feels that the wife is doing things on social media behind the backs. And there's quite an interesting study in Pakistan on that. So there is research out there, but not on specifically on the question that the person asked. So I just wanted to kind of build on that topic, and there's a lot of interesting stuff out there, yeah, that kind of shows what you guys have been saying.
Do you remember the Ring the Bell campaign in India? I don't know if anybody was, maybe 10 years ago now. It was not as social media-y because it was 10 years ago, but it was a widespread campaign with a lot of commercials about like ring the bell. So if you hear something happening at your neighbor's house, just like ring the front doorbell. And it was really trying to push that norm of like, this doesn't have to be something you just ignore or are paralyzed by or is normal. And so I think that with social media accessing people who are maybe more powerful in some ways, you know, accessing men who might be more empowered to go and ring that neighbor's doorbell, things like that could be fruitful.
Sarah, I think this one is also for you actually. So any indications that the findings from your work are similar to those in other regions?
I'm afraid I'm a really bad person to ask, because I've been based in South Asia for the last 13, 14 years, and I've barely left. So, and because of COVID, I literally have not left. So, but my general response would be is that wherever there is gender inequality, you're going to see the same thing, and there's gender equality all over the world. And you know, if men are economically worse off or less educated, then the women in the family are likely to be even less educated and less well off. And so you're gonna see these disparities wherever there are differences. I think in, you know, there are these gender-based inequalities. So I don't think we focused on India because that's where we've been doing our research, but I don't think it's unique to India at all. But that's just my assumption. Maybe somebody like Diwakar will know better.
I can quickly,
Alex.
I can quickly say from sub-Saharan Africa, there is wide range of variation in this gap among different countries. And many of these especially have to do with the way that the mobile phone is used in some of these countries. So for example, in Kenya, where a phone is required for monetary transactions, there is a much greater involvement of women with the use of mobile phones as compared to, say, another country like Ethiopia, where it wasn't as prevalent as Uganda or Kenya with regard to monetary transactions. So there are these kind of unique variations that have been introduced because of the way that some of the programs have organically grown in these countries. But yes, there are quite differences. There are similarities too.
If you look at the Oh, sorry, Alex, I'll hand you in one
No.
sec. Just to say, if you look at the GSMA gender gap report, it does present some differences in the gender gap stats across regions, but not for a lot of the social media, data that Sarah's talking about. Alex, over to you.
Sure, thank you. Just to build on what you've all been saying, I know that you popped the GSMA one into the chat. I would also add that there's quite a lot of data. There's more data sources out there that do kind of show different countries. So there's Web Foundation, there's Financial Inclusion Insights, there's a lot more data than there used to be. And a lot of them do show these kind of trends, as you said, Dr. Mohan and Amnesty. But I would also say that there's actually quite a lack of data out there for many countries as well. Even the GSMA report, which is, I guess, a benchmark in many ways, that doesn't cover many countries. And so I think this is something I think you said, particularly Amnesty and Kerry, like there's a real lack of data generally. So yes, the data that's out there does kind of show these different trends, but there's still so many countries where we have very little insight into.
Actually, I was at the GSMA with working alongside that team, and the big issue as well, as panelists have mentioned, is the lack of understanding of who's actually owning the phone, where the access comes from, and so on. So the challenges are very much systemic. Amnesty, are we going to jump in? Sorry.
Yeah, no, I was going to say, so in addition to sort of broader agreement on the metrics, I also think the methods for implementing these surveys can vary widely across the type of organization. Like, and Colin, you may know this better than me, but I know a lot of GSMA surveys often rely on sort of more marketing, rapid, simple random surveys, as compared to sort of, the demographic and health surveys or the mixed survey, which would be, a countrywide survey that's more representative, perhaps at a population level. So even with the small sort of disparate countries that are often selected in these reports, the quality of the sampling and the underlying methods for me is a question mark. So over to you.
No, not at all. Agreed. And I think Diwakar mentioned earlier, things like the DHS and other surveys, which are foundational statistical assets, but obviously cost tens of millions of dollars to run as well. So yeah, there is a real kind of dearth of, I think, foundational data. Just one final question in the chat, and then there's a few slides just to wrap up. How can we deliver effective digital health information for refugee populations? So one is mentioned in here is the Rohingya. So obviously they're kind of ethnic minority who do not actually have a formal written language, but I think more fundamentally, marginalized and vulnerable populations like refugees. Amnesty, do you want to jump in first on that one? Or...
Yeah, I quickly can. I think it's just one, I imagine with Rohingya as well, you have issues of the mobile networks actually also being disrupted or shut down to some of their geographic areas by the military in Myanmar, or in the case of there in Bangladesh. I don't, I imagine the disruptions is an issue. So even if you do get the channels open and can get them in an appropriate language, it can be difficult to have continuity in that line of communication. So so that issue aside, I think you have to have diversity in the modalities, recognizing that there's varied literacy, varied languages, and I think you have to have varied modalities and varied types of digital strategies. And Sarah can maybe say a little bit about the direct-to-consumer type platforms they're trying out in India, but that's one type of example of kind of a technology layer that can enable, sort of everything from IVR to SMS to chatbots. Sarah, I don't know if you want to add.
Yeah, in fact, one of our really brilliant producers by the name of Shefali Chaturvedi, she was actually seconded to work in the Rohingya refugee camp in Bangladesh, I think with the WHO, and was working on radio programming. So let's not forget about radio.
Oh, sorry, I forgot about radio.
Now, of course, there is radio that's accessible on people's phones. So the mobile phone can become a pocket radio and is a great device for that. But radio programming is still can be an incredibly effective way of reaching people. And I know that some really engaging, impactful communications have been done. So yeah.
Thanks, Sarah.
But Sarah, just quickly, I mean, would you say, just to answer that question from a technology perspective, other than sort of radio, I mean, are you in favor more of sort of like this sort of layer of having a like a D2C layer, direct to consumer layer, which can accommodate different types of, you know, content,
Well,
if you will?
I just don't quite see how they're all going to have mobile phones. I mean, first of all, mobile phone penetration was incredibly low in Burma to start with. Yeah, in Myanmar to start with, and then they've fled for their lives.
Sure.
And then they're in refugee camps where, I mean, getting a SIM as a foreigner is not straightforward. I mean, it requires all kinds of documentation to register, to get a SIM, and you know, what you say, okay, I live in the tent, you know, down the beach. I mean, there's a lot of challenges. I think, I mean, this is one of the things that I think is really important, that, and perhaps why, you know, BBC Media Action's digital interventions in India, for example, have reached, you know, 10 million families, and we've used them to train hundreds of thousands of healthcare workers, and they've been extraordinarily effective, is because we designed them to appropriately, you know, with the people that we're trying to serve. And, you know, if you go into, sorry, go ahead.
No, it's fine. I think fundamental point, very much focusing on the needs and realities of our users, beneficiaries, and so on. Just to wrap up quickly, there's a few slides just to show you all. Firstly, thank you all for joining. This is the very first in a series of talks we have. And we'll walk through the other topics in a moment, and also share all of this via email, both the recording and the PowerPoints, and some further information too. There's also going to be some forthcoming kind of wider work as well. We've got on the screen there the kind of BMJ global health work, global policy special issue as well, which will broadly be aligned to the topics we're talking about. And then just to the final slide. Thank you. So this is the list of webinars that we have planned over the next year. We've got hashtags at the bottom of the screen. We'll also share contact details via email, but we very much welcome your comments and feedback on both the list of webinars here, the workshops we have listed as well, and also the panelists, topics, and focus areas that we explore in each of these discussions. So thank you again all for joining. We look forward to seeing you again in the future. To follow our work, you can sign up on Twitter, LinkedIn. We also have a gender health hub as well, website where we'll be posting more information about the series, supplementary resources, supporting material, and so on. So look forward to seeing you all at future sessions and also online as well. So thank you all for your time.